Welcome back to the Nutrition Connection podcast, the show where science meets storytelling. I'm your host, Dr. Kristen Hicks-Roof, dietitian, researcher, and lifelong advocate for the role of nutrition, health, and wellness. Each episode, I sit down with dietitians and nutrition experts all across the food and healthcare landscape, leaders whose work touches nearly every aspect of our lives. So whether you're a student, a seasoned professional, or someone simply curious of the role of food, nutrition, and health, this podcast is just for you. The views, thoughts, and comments on this podcast do not reflect those of my employer nor the employers of my guests. So let's go ahead and get connected. I am so excited to bring on today's guest. She's a former Academy of Nutrition and Dietetic president, but we have Lucille Beseler. She's the president of Family Nutrition Center at South Florida. Welcome to the show, Lucille.
Oh, I'm so excited to be here, Kristen. This is so wonderful. Thank you for inviting me.
So Lucille and I have crossed paths when I was in Florida. I remember helping to get you some votes when you were running in an academy ballot. And really, it's always great to connect with Florida dietitians. So Lucille, what inspired you and made you want to become a nutrition professional in the first place?
I think that's a really great question. And I find that I'm asked that question a lot. So I reflect on it. Every time I talk about it, I reflect on it. So first, I'd like to say I was the first one in my family to go to college. So I didn't have a lot of maybe help thinking about a career path. That's number one. So my mother did everything she could to get me to college, but she always said that at that time, she did go back for her degree, at that time that she didn't really understand what was available to us. I always wanted to go into health. I had wanted to be a physician. So was told by someone in high school, one of my teachers in high school, that she didn't think that I was really smart enough to be a physician. So I guess I must have been a very obedient kind of like, okay, if you don't think I'm smart enough, that's fine. So, so I didn't pursue that, obviously. But I still wanted to stay in health, and I knew how important nutrition and food was. I had learned how to cook when I was 5. My Italian grandfather taught me how to cook, and my grandmother was she had diabetes, and she was very overweight. And so we kind of always knew that her health was a problem because of her weight. So because of that, I wanted to do something in health, something with nutrition and food. And voila, here I am.
That's awesome. Well, and it's so cool that you knew that you wanted to go in this health discipline. And you know what's so funny? I find so many dietitians that I interview and they were like, I'm thinking about going to medical school, being a physician. And then it's like, once they open this door to nutrition, they said, wow, that's where I feel like I belonged all along. I just didn't know it.
That's interesting. That's very interesting. Well, I don't have any regrets because I think that maybe my professor at the time knew that I didn't have maybe the stamina to go to medical school. So maybe she was right. I don't know. But
You
I
have
don't
such
have any regret.
when you have such a business mind, which we're going to get to this, so maybe she saw more than just the health, right? And I think maybe there's more to this business where you really excelled.
Well, that's really interesting that you would say that because I didn't become business minded until I moved to Florida. But one thing, I started working when I was very young. I started working when I was 15. I kind of forged my papers a little bit, as they say. And so I was always really interested in working. I was a very hard worker and I loved working. So yeah, maybe there was that little bit of business there that I was showing them. I'm not sure.
So let's discuss your journey. You became a dietitian. What happened after that? What kind of roles have you had to where you are today as a president and really owner of this new company? And
So
not
I
new, this big company.
Yeah, well, it's been around a while. So I became a dietitian. I was really fortunate. ARA at the time, it was called ARA. They paid for me to go to graduate school at NYU. So I was really fortunate. They paid like 80%, and I was working for them, and I was working at a couple of contracts, really kind of tough tough hospitals. And there was a really big hospital strike in New York, and it really lasted about 60 days. Why that's important is because after 60 days of chucking garbage and doing all the things that a chief clinical dietitian would do, I decided I want to do something different. So I actually applied to the Children's Hospital and applied for a position there as a genetic nutritionist. It was all research. And at the time, I was very research oriented. I was really excited about it. And I didn't know what the heck a genetic nutritionist did. So I asked all my friends and they said, "I don't know." So I went into the interview. I said, "Let me give it a try." I went into the interview, hit it off with the PhD MD, and he said, "You know what? I like your nerve because there aren't very many genetic nutritionists, and I'm going to teach you everything you need to know." So that kind of started my path in pediatrics. And then at a point, I decided I wanted to come to Florida, be with all my family. And I decided I wanted to open up a nutrition practice that was dedicated to pediatrics. I knew I wasn't going to do those genetic cases because that's really housed at a children's hospital. But I had enough contacts, enough people who had trained at the children's hospital that I worked at, and they were now in practice in South Florida. So that started me on opening a practice. And then we decided, okay, it's great. We love pediatrics, but let's expand it and open the practice. And we've done, God, really, I'm so fortunate. 34 years, we've done it all.
Wow, that's crazy. 34 years. And kind of give us a little bit of intel for those who don't know you. What does this practice do? How big is it? I know you have dietitians under you, so maybe you can give us some detail here.
So the interesting things, it's like I said, it's 34 years old. We're on every insurance plan. Were we on any insurance plan when we started? No. And none of the insurances were really taking dietitians. So I really felt like I was a pioneer in South Florida to get insurance coverage for a lot of conditions and especially a lot of pediatric conditions. So we are a nutrition counseling practice. We get referrals from doctors, nurse practitioners. We do nutrition counseling. Now we do it virtually. Since COVID, we've been doing it virtually. So, and then we do a lot of other things. One of the greatest projects that we have done over the years, and I'm so excited about this. We did it for about 8 years. It was an insurance navigation program, and we were working for a company where we would actually help families get coverage for specialized infant formula. And we helped so many families. And when I say we, it was my team. I have administrative um, individuals, I have dietitians. And you know that kind of waxes and wanes. At one point we had 8 dietitians, and now I really am, this is the first you're hearing it, I'm cutting back a little bit and will be in the process of actually handing over my practice at some point. So we don't have as many dietitians now, but that doesn't mean that we can't keep building because we have all the insurance contracts, we got lots of referrals, and then we do a lot of other very interesting work. And that insurance navigation program was one of the most interesting, and it really helped so many people. So it made all of us feel so great.
Well, yeah, and then I know you and I have talked about it often over the years of just dietitians. Yes, we can offer incredible services, but if they're not covered, we're not optimizing what
Right,
we are doing, right? And
right.
so it really takes those pioneers and leaders. And I know you really are an expert in insurance and billing. Don't you have a course going on right now about
Yes, we
insurance and billing?
do.
Okay, tell us about it.
Absolutely. Oh, I'm so excited you mentioned it. Okay, so the reason that Marcia Schofield and I decided to create this course is because we're both really big experts in insurance. Not to be modest, we really know it all. So we started seeing that there were a lot of people who were offering a lot of courses out there for dietitians and charging them a lot of money. And there's something, you know what? I've been very fortunate to do well in my field, work very, very hard, but do well. And all I want to do is give back to my colleagues. I do not want to see colleagues having to pay thousands and thousands of dollars to open a private practice. Nobody's going to give you anything for thousands of dollars, you know. So Marsha and I said, hey, this is a good opportunity. Let's put out these webinars. We'll make them very cheap just to cover, our costs, so to speak. And we really can get people on board and give them the right information. So today I just posted something about Z codes because there was a post out there that you could bill with Z codes. You cannot bill with Z codes. So people were getting lots of denials, and they're all in a hoopla on social media because they're getting all these denials. And Marsha and I are saying, oh, you should have taken our course. You would have known you can't bill with a Z code. So thank you. We're doing that just because we want to give back to our colleagues and to get them on board to understand what it's like.
Well, and I think it's such an important time because you do see a lot of dietitians continuing to move in the private practice realm and they want to accept insurance. They don't know how. There's a lot of questions because as a former professor, we don't have the depth and breadth of not all the time of reimbursement and billing. Plus, things change regularly, right? With
Absolutely.
new
Right.
policies and new guidelines. So
Right.
I think it's a great opportunity that you can connect. It will be in the show notes so that way you can connect with Lucille and learn more about all of that. So, Lucille, between some of these webinars that you're putting out in your business, talk to me. What do you do in your current role? What does your day to day look like as the president of the company?
So, right now, I kind of have stepped back from patient care. I only have a certain amount of patients that I see. I'm a little bit of the tube feeding queen too, so I do see a number of patients who are on tube feedings. But what I really do is I take care of the administrative work, oversee billing, oversee operations, and then deciding how we're going to transition this business if I stepping away from it a little bit. Just a
And,
little bit. I'm
and I
saying that.
know
I'm getting nervous saying that, Kristen.
I was gonna say, I know you. You're like me in the sense of you're a yes person, you're super driven. And so I can imagine that is a huge challenge, but that is part of as people move into practice and they have maybe dietitians under them or their practice grows, at some point they will want to transition. You're in sunny Florida. I'm sure you want to retire, right? And
Right.
so
I
what
mean, it's kind of the normal progression, except that I really don't want to retire because I'm one of these go, go, go people. So instead, now I'm doing all different kinds of consulting. So I have a couple of contracts with some groups where I'm going to be consulting. Plus, I did write a book on feeding infants and toddlers, nurturing with nutrition. So it's gotten a lot of really good publicity over the years. As a matter of fact, I always say, like the best, what do they say, like the best accolades is someone using your work a little bit. So it's time to update that, and I've been trying to update that.
Well, and I feel like if you're
Excuse
anything
me.
like my one of my mentors, Dr. Judy Rodriguez, she retired from UNF when I was there, and then she's still doing contract and consulting. Like you always see her in the nutrition space. So I think as dietitians, especially that type A part of us, we always want to stay connected in. And once you have had such a successful career like you've had, it's so cool to be able to stay connected in and like still be part of the nutrition community. So, Lucille, how does scientific evidence and data inform what you do in the day to day?
Well, I think that when it gets down to patient care, that research and guidelines from various groups are going to be really important. How we apply that to our individuals that come to see us. At the same time, I think that, I'm not in the research setting. I'm not in a research setting, but I keep an eye on scientific guidelines. I have to. But I think when you actually are caring for patients, you have to be a lot more reasonable about what they can do to change their lifestyle and change their disease. I kinda laugh, about this. Of course, it's not laughable, but the whole thing about dietary guidelines. So we have a joke now. Nobody has ever called our office in 30 something years and said, "Could you make me appointments so I can learn about the dietary guidelines?" They don't. But yes, we need to know that science and research so that when we do have a patient and we're providing a good evaluation, an assessment evaluation, we can really then know how to put those nutrition guidelines for them into practice. But it gets, the whole mix of it is we seem to forget about the human in there, and that's really the most important person in that, right? Or the
Yeah,
most
no,
important element. I don't
and you're
know.
so right. Like when we think about some of these massive food policy guidelines, I think a lot of like day-to-day consumers, they don't really understand how it impacts them. And one of the things that I've been trying to educate dietitians and other folks outside of just dietetics is the guidelines fuel many feeding programs. They fuel a lot of educational interventions. And so it's that how do you take the science and be able to inform all of those different feeding programs. And then how does that impact us as clinicians? I remember when I was a corporate dietitian and people would come with and ask me a question like, "Hey, my friend is on this such and such diet. Can you tell me more?" And so we have to have some scientific basis, but then also recognizing that each individual person and their wants, needs, desires, and preferences are very different.
Right. And
Yeah.
sometimes don't you think that that's difficult sometimes just because in the nature of the beast as dietitians, we tend to, sometimes we have blinders on and we're like, "Oh, no, that can't be that way." But, you're dealing with real people, and if you really want to change their life, the trajectory of their disease, you have to be in tune to them.
Oh, I 100% agree. You will almost never see me say something concrete. I live in the gray zone because science is gray, right? Like what an epidemiology study versus a randomized control trial and how those differ. Like we have to live in this moment of nuance because what a patient wants or needs, there's nuance in what the clinical research can actually apply to them because whether maybe they're a different race or ethnicity that may not apply to the research being conducted, or their socioeconomic status is different than those that were studied. So there's a lot of nuance and a lot of gray area. So Lucille, you have had a very successful career, and but what is your most favorite, or what are you most proud of in your career?
Oh, well, there's so many things that I'm proud of. I always say that I'm just really proud to have a business after all these years. Businesses, they are tough to keep. I always kind of chuckle when people say, "Oh, I have a little business on the side." On the side of what? Because it takes everything you have to keep a business going. I've had employees, I have 2 employees that I have had for almost 20 years. That to me makes me very proud because 'cause they're like part of my family, so that makes me very proud. So having that business when I never thought that I could be a businesswoman, I never in school was ever taught, "As a woman, you could be a businesswoman." And, that's something that we need to explore more. I was fortunate because I mentioned my mother. My mother went on for degrees. She was a divorced mom of 2, and she was a bank teller. Well, she ended up at the end of her career being the president of a bank. So I had that inspiration, but it came a little later. It didn't come as a college student. So I think that's one of the that I'm most proud of is that business and then the relationships that I've made with that. And then always being able to reinvent ourselves. We have done so many things. We had a contract with the insurance company where we actually went to events all over Florida, and we hired dietitians all over Florida. It probably was when you were up in North Florida.
Yeah.
And this insurance company would have booths like at the tennis open and this and that. And we would staff dietitians, and the dietitians would do body fat analysis. I know you think nobody wants their body fat done. They all used to line up for that and do blood pressure. And then we even were able to do cholesterol screening at some point. And so we really pushed the envelope and did a lot of different things. And I was always very proud of that. Any opportunity, to get in there, any time to reinvent something, I was there. And I think I'm proud of that.
I think there's so many opportunities for dietitians. I've dabbled in corporate wellness for nearly a decade. I did the other day, I was at a health fair at a company, and it's so fun to be able to connect with real people because so often than not, especially in my role now, I don't have one on one counseling or one on
Right.
one education. And so I need to go with the people, right, at some point to be able to learn from them. Like, here's things that are fad diets right now. Here's things like, do they want to get weighed or get body fat percentage? Or maybe they don't. Like, what's in and what's
Right.
out? Because what you see on social media is very much tailored to you and it may not be representative of everything.
That's true. That's true. It's just so great to get out there. I agree. And they're not people who are forced to come and see you. You're out
Right.
in the community and they really want to talk to you. They get excited and they want to talk to you. So there's so many good opportunities. You just got to put yourself out there. It's hard work, though. We know it. Really hard
It
work.
is hard work. So, one thing that I think is such an incredible recognition is being the president of the Academy of Nutrition Dietetics. I mean, what an honor. And I'm just curious if you would be able to give us a little insight. If someone has that as a career aspiration, what would you recommend them to do to try and achieve that milestone?
Well, first, thank you for the kind words. I will say I never, ever had that on my career list or my goals to be the president of the
Really?
Academy of never. So I think if somebody does have that, I would want to say, why? Why? What do you think you could do to better your profession, to support your colleagues? Why do you want it? And then here's the reality. The reality is it doesn't line your pockets with gold. Not at all. I laughed because I said to people, it cost me more money to be president than because I had to have people take over for me when I
Right.
was away from my job. I find, because I happen to be now the chair of the nominating committee, I find the people who do the best are the ones who really, what I say, have an unselfish heart. They want to have a position on the board, be the president, because they really want to make a difference and they want to help the membership. How it happened, I just always said yes. And the first time I said yes was in the hallway at a Florida meeting, and it was to be on the Dietetics Nutrition Practice Council. And I always say, well, I was kind of lonely. I didn't know anybody in Florida. I just had arrived to Florida from New York. I didn't know anyone. And you know how everybody hates those brash New Yorkers. So so I said, "Oh, somebody wants to be friends with me. That sounds great. Okay, yes." So, and I always tell Chris Table it's her fault. So I ended up saying yes. And then it was just a series of yes. If people think I have the talent that they need at that time, I'm happy to do it. But no, I never aspired to be president of the Academy of Nutrition and Dietetics. As a matter of fact, when the nomination came in, I said, okay, this is a dilemma. What should I do? And somebody who's very wise said to me, what's the downside? And I said, well, I'm going to be away from work. And what's the downside? So what did it do? I felt that It was important for me to meet as many members as possible. I used to say, if it takes a plane, a train, and a donkey, I'm there. Okay, So I would go out and meet the members as much as I could at state meetings, at national meetings. I also represented us at national meetings. Now, to me, that was important because many of these national meetings, this is where things are happening. This is where coalitions are forming. And it was important for me to be there to represent the academy. So it was a very proud moment, and I will say Fancy was the best time of my life when I spoke at Fancy. I had all my Florida peeps, if you remember, in a little
Oh, yeah.
area. Yes, and I was really very proud of it. What did I accomplish? I hope I think we did some good things. Obviously, business was an area that I wanted to focus on. And we had the Nutrition Care Summit where we brought 200 leaders in business and health together. And that was really wonderful. I will tell you, the Academy has had its share of problems. And a lot of times we end up being reactive. And that's what I'm worried about right now, too, Kristen. I'm looking at social media, and this morning I just hung my head because the bullying, the just the nastiness, we have to focus on what's important. Nutrition is important. Fighting amongst each other or calling people out or bullying them or telling them they have no right to be a health professional if they have a different view of somebody else. This is out of control, and this is not helping our profession because it's not strengthening our profession, and then other people are watching us implode. They're watching us implode, and they're very happy to step up when we do it.
Well, that's something that I've talked about with many dietitians over the years is how to have public discourse and just say, hey, we have, show me the science behind what you're saying. Show me the science behind what you're saying. Because honestly, there's science on all sides because it all
Right,
depends what type of evidence you're looking at. And so I think it's keeping an open mind, right?
right.
And not only keeping an open mind, supporting each other. You may not agree with everything that that person might be doing, but that person is in our field and really trying to advance public and community health. And so I agree with you, Lucille. And thank you for your advice and tips because hopefully there's some listeners on here that maybe one day do aspire to be president. And how do we bring our profession together? So, what suggestions would you also have for people who maybe are interested in starting their own business, starting
Ah,
their own practice, or insurance and credentialing? So what
okay.
kind of tips or advice would you give?
So of course I'm gonna say they should take our little course because that's gonna really help. But think about, if you really wanna start a business, it's very easy now to ask your little ChatGPT friend and your Gemini friend, what is the framework for starting a business? And then you have to decide, what do you want to do? Do you want to counsel patients? Do you want to be a consultant for companies? Do you have a special area you like to work in? Do you like to work with people with diabetes, chronic kidney disease, GI disorders? So I think if you are interested in starting a business, understand what you want to do. You have to understand you might have to be flexible. I always say, I always used to wash the floor in the toilet because somebody had to do it. So you
That's
have to
true.
be flexible, right? But map out what you'd like to see. Then, if that includes that you have to be on insurance, then you're going to need to know about the whole insurance game. But if you wanted to start a boutique practice where people pay, that's great. You know,
Yeah.
we always say cash is king. That's great. So then you don't have to do as soon as you bring insurance into it, you have to bill, you have to get credentialed, you have to bill, you have to have staff to do that. So it makes it more complicated. So I think that the person who wants to start their business, they have to understand what they want to do and what's their
Well,
future going to be like.
Well, and you had such a good point of like, are you having a niche or do you want really a more generalized practice? And I think one of the other areas, which I know I talked to Central Texas A&D years and years ago, was how do you expect your referral system to come through? Is it a physician that you know? Is it friends in the other facilities? Is it online social presence, right? So thinking about not only what's your business, but how are you going to acquire the clients in the first place?
That's right. That's right. And how do you scope out the demographics of your community? So if you want to stay in your community and you say, well, I want to work in diabetes, then maybe you need to do a little search in your community. How many individuals have diabetes? If that's not a big issue in your community, maybe you got to move to another community or maybe you have to look at something else. So there's a lot of homework that goes into it.
Yeah. Well, and I think you can reach out to mentors, people who've been in the field, people who've been having practices. So there's a lot
Yep,
of folks out there who are willing to mentor and give guidance. So you don't necessarily need to pay for everything, but how can you help them while they're helping you? I love that concept of reciprocity and making sure that when we're doing
absolutely.
mentoring and giving back to our profession both ways.
Yep.
So, Lucille, my favorite question to finish off, if you had a crystal ball, what do you think is coming next in nutrition?
That depends on us, Kristen. I really feel it depends on us. We have to get it together. I'm going to say it again. Stop with the infighting. Stop this, this, and this. And then the person who yelled at me this week on social media. Let's make sure that we are a strong association so that we could be ready for what's coming. What I think is exciting, AI got to be the most exciting thing. Why? Because it's going to help us deliver personalized individual nutrition care. It's like yesterday I heard about colonoscopies are now being done with the physician and AI because the
Probably.
physicians do, and I know this because a friend of mine is a nurse clinician in the colonoscopy suite. They do 25 colonoscopies. There's things that are missed. So now AI is going to help. This is exciting for us to think like, oh, AI is going to take my job. No, we have to figure out how to embrace AI so that we could provide really individualized nutrition care so that we see we are now more an integral part of the healthcare team.
I mean, I have been a huge advocate. I mean, as my research for nearly 10 years of the role of nutrition and dietitians on the healthcare team. And I think there is such a revolutionary opportunity with AI. I mean, I remember when I used to do some research, one of my like pet projects that I never ended up getting to publish because I left academia, it was looking at how do you use robots in healthcare systems so dietitians could tap in on the robots and they would be able to go talk with patients when the dietitians are not in practice. And that was early AI. I mean, these are some of the first generation robots. And I think while robots is a form of AI, I agree with you in the sense of AI has such opportunity to optimize and personalize nutrition, and dietitians can be part of that every step of the way.
Absolutely. And think of the outcome, the changing outcomes. Because if you have that little robot in the home who's helping with these modified meals to make sure your individual with chronic kidney disease is getting the right amount of sodium every day, tell me that's not amazing. And we should be there.
I know. It's exciting. It's really exciting. Well, thank you, Lucille, for being on the show. If you like the show, make sure you like, subscribe, leave a review, but ultimately catch the next episode because every episode I sit down with different dietitians and nutrition experts, and you'll learn something new each episode. Thanks again, Lucille.
Thank you.